Every September, we come together to recognize Pediatric Cancer Awareness Month. It's a time to honor the courage of children battling cancer, support their families, and raise awareness about the urgent need for research. 80% of kids diagnosed are cured because of research, and we're lucky to have one of the best facilities in the world right here in Southern California. Joining us to talk about the positive advancements and treatments, Dr. James Amatruda, the director of the Cancer and Blood Disease Institute of Children's Hospital, Los Angeles. That is a mouthful.
Yes, it is. Well, good morning.
Good morning. Thank you for being here.
Thank you so much.
And thank you for all the work you're doing in this space. There have been major advancements.
Yes, I'm really delighted to be here on behalf of all my colleagues at Children's Hospital Los Angeles here in Childhood Cancer Awareness Month.
Yes. So talk a little bit about some of the misconceptions people have about childhood cancer.
Well, let's face it, hearing the words "your child has cancer" is probably every parent's worst nightmare. But part of the news we want to get is exactly what you said. The cure rates have been improving very steadily, up to about 80% overall. And of course, what that means to us is we're not at 100%,
right.
So it's really unacceptable.
Yeah, and talk about how research does play such a big role in trying to get that number up from 80%.
Well, the progress we've seen over the past decades has really come through research, through cooperative research from children's hospitals like Children's Hospital Los Angeles and our colleagues around the country and around the world. By putting together our best ideas and our best data, we can really see steady improvements in treatment outcomes. But we know that this comes with a cost. One of the big areas we're trying to work on now is to make the treatments more effective and less toxic for children.
Because that has a longer impact? Is that?
Sure. Most of the work we've done in the past decades has been using chemotherapy, radiation, and those treatments can be very, very effective, but they're very tough on kids and they can cause long-term health effects. And that's what we're trying to move away from through research.
And, I know so many adults who end up in trial programs and those types of things. Can you do that with children, or is it less likely?
Yes, we have more than 200 clinical trials at Children's Hospital Los Angeles for children with cancer. And what we're trying to do very much is to, as I said, make those treatments more targeted and precise. From understanding how the cancers work, what the wiring diagram is, can we devise treatments that are much more effective and only target the cancer cells?
Which would be a huge improvement later in life?
A big improvement, trying to, the whole goal is to let that child thrive, go to school, grow up, live a long, healthy, productive life.
So I have a couple friends who had childhood cancers, and one has had enormous health impacts as he's gotten older. The other one is fine and has never had, any other problem with it. Is it just dependent upon each person, or?
It's also very dependent upon the type of therapy. So we have a very large survivorship program in our hospital. So patients, we follow them for many years after their treatment, being on the lookout for those problems that may be related to the chemotherapy or the radiation. And we know that certain types of drugs have more impact, and that's what we really monitor for.
And how are you trying to personalize your approach when it comes to your work at Children's Hospital?
So the big revolution in understanding cancer has been really to look at the level of the DNA, so the instruction set inside the cells. And when we can now detect those types of changes or mutations in the DNA through a process called personalized medicine. We're very, very fortunate at Children's Hospital Los Angeles to have one of the most advanced DNA testing labs in the world. And so when patients come in, we can more quickly arrive at a diagnosis and get to that wiring diagram question.
And I'm sure for parents, that's a relief.
Again, it's such a hard time, but we feel that we can speedily arrive at a correct diagnosis and really map out the plan from day one. That, I think,
can give some hope.
Can give them some hope and reassurance, exactly. And we're very fortunate to have a multidisciplinary team of experts from every area of medicine to apply.
Well, thank you so much for being here, and thank you for all the work that you do.
Thank you so much.